Hello and welcome to the Lumbar Fusion patient education session. I'm one of the spinal nurse specialists here at the LGI. I'm part of a team of 4 nurses and we'll be here as a point of contact for you during your surgical journey. We've come together with a team of physiotherapists, pharmacists and the pain team to form the Enhanced Recovery After Surgery or ERAS team. We've put together this presentation in order to guide you and inform you of what you might expect pre-operatively during your hospital stay and following your discharge. So by now you should have received a date and a time for your operation, and you may or may not have already had your pre-assessment. With any concerns or queries regarding this, please contact the theatre scheduling team. The number's in your spinal booklet. Pre-operatively, there's many things that you can do to optimise yourself and your health prior to coming in. We ask you to keep as healthy as you can be before you come in and ensure all other medical conditions are as manageable as they can be. Many of our patients do struggle with constipation, so it can often be helpful to try and manage this as best as you can before you come in to try and prevent any further complications post-op. We ask all our patients to stop smoking to reduce the risk of infections later down the line. Please ensure you have someone that can collect you from hospital following surgery. Transport is not routinely offered and it will speed up your discharge on the day if you have someone ready to collect you. Please ensure any arrangements are in place to support you following your discharge, whether that be someone at home to look after you, your family or your pets. It can be helpful to prepare your home ready for your arrival so that the house is clean and you have food in, whether it be microwave dinners, bread in the cupboard or milk in the fridge. At your pre-assessment, you'll be offered an antiseptic scrub, so please ensure that you've completed this course before you come in.
Hello, I'm one of the physios, member of the Spinal team. We'd like to just go through a few things that we'd like you to be considering doing before you come in for your surgery. It's all about improving your exercise tolerance. In that way you are likely to recover from your surgery quicker than you otherwise would. Now that might involve carrying on with exercises that you are doing already. For those of you that are not really into exercise, even if it's just starting to do a little bit of walking, it won't go amiss. Other things that you can consider are swimming or even doing a little bit of exercise bike if you have got provision for such. If you exercise on a regular basis, you can continue to do so, but you just need to be careful to avoid certain things. We would rather that you didn't do any lifting of weights if you go to the gym. We would also need you to be cautious if you were considering any impact exercise. So that includes things like running. It would be better if you didn't do that. We will be going through some exercises later that we will want you to do after the operation. We will go through them and show you how to do them. But if you could start doing those gently now, it will serve you well in the future.
On the day of your admission, as specified on your invitation letter, we ask that you consume no food, chewing gum or flavoured drinks after midnight. You may take some clear water until 6 AM and then fast. We ask you to take all your usual medication unless otherwise specified with 250 ml of water before 6 AM. You'll be admitted to the ward on the day of your surgery. Where this will be specified on your invitation letter at a specific time. Please note this is not the time of your surgery. You'll be reviewed by many different members of the team, including the surgeon, anaesthetist, the ERAS team and members of the ward. You'll be placed on a surgical list. Please note that this list order can change throughout the day. There is always a risk of cancellation on the day, so please be prepared for this. You'll be given an idea of how long your operation time will be. Please note you will be off the ward for a longer period of time from this, as you first go to an anaesthetic room and then spend some time in recovery afterwards. You will also be offered some DVT prophylaxis, whether this be in the form of TED stockings or a mechanical version. On the day, please bring in all of your medicines and prescription, a change of clothes, some toiletries, your spinal booklet, a book or a magazine to pass the time, some non-slip comfortable footwear, and many patients find it helpful to bring in some sugar-free chewing gum for after their surgery to help with any problems with constipation.
Hello, I'm one of the pharmacists that will be working within the Spinal ERAS team. So I'll be managing your medicines throughout your surgery process. Depending on what medicines you take, we may ask you to stop certain medicines before and during your hospital stay. This will always be based on an individual basis, so there may be changes throughout or there may be none at all. Examples of medicines that may be stopped throughout surgery can be anticoagulants or antiplatelets, sometimes referred to as blood thinners, or anti-diabetic medicines such as insulin and metformin. In regards to your medicines, it is important that you do the following. Ensure you have a regular supply of your regular medicines. Bring a medicine supply with you into hospital and make sure you have a supply at home. and bring a prescription or an up-to-date list of your medicines so we have an accurate record of what you take.
Hello, I'm one of the clinical nurse specialists from the pain management team. Within our team, we have a series of clinical nurse specialists like myself and a group of anaesthetists. What we can do is we can come and see you post your surgery if you require a specialist pain intervention. It is likely that you will have some pain after surgery. This is quite normal. Regular observations will be taken by your nurse to review your pain score. You will have prescribed analgesia individual to you and your type of surgery. The aim is for you to be comfortable enough to deep breathe, cough and mobilise. Here within Leeds Teaching Hospitals, we utilise a pain scale 0 to 3. Take this very simply as 0 as no pain, number 1 as mild pain, 2 as moderate pain and 3 as severe pain. The nurses will regularly come round and ask you what your pain score is. Just simply reply 0 to 3. After your operation, you will take tablets to manage your pain. If your pain is increased, we may start you on a machine which is called a PCAS. That stands for Patient Controlled Analgesia. Your anaesthetist will choose for you which is the most appropriate, tablets or PCAS, prior to having the operation and have this discussion with you. Post your operation, try and be in control of your pain and be mindful. Simple things like position changes or distraction therapies. Make sure that you communicate with your nurse when your pain increases. This way, the nurse will be able to get you some extra painkillers to make sure that your pain is adequately managed. You will go home with some pain medications, but please have a supply of paracetamol at home. This is so you can continue to be comfortable enough to progress in your recovery at home. When you go home, your GP will be informed of your type of surgery and also what medications you will go home with. There is evidence to suggest that receiving a pre-operative dose and a 1-day short course of gabapentin can help with post-operative pain. You may be offered this on the day of your surgery if you are having a decompression, microdiscectomy or a 1-level fusion surgery, and this is if you are not already taking gabapentin and if you are not allergic to gabapentin. Please make the ward staff aware on the day if you feel that you may be eligible for this trial. After your surgery, you may still be experiencing some of your pre-operative symptoms. There will be some surgical back pain, which is expected, and we do not expect you to go home pain-free. However, this should be manageable with pain relief. Sometimes you may even feel slightly worse before you start to feel better. Nerves can take a long time to recover, up to 2 years. Not all function and sensation always returns to normal, so please be aware of this. It is always important to move regularly as able, and this will help to alleviate some of your symptoms in the long term. After your surgery, you'll come back with a dressing. This will be inspected by the ward nurses and the doctor to ensure that it is clean, dry and the dressing intact. We do not change this dressing every day unless it's soiled or the dressing comes off, and this will be the case once you go home. The ward will provide you with some spare dressings, but only change if necessary. If not required, just leave the dressing in place. You can shower after 48 hours, keeping the dressing as clean as you can, and please avoid bath for 6 weeks. Sutures are usually dissolvable, but if not, instructions will be given to you regarding when these should be removed. Your dressing should be removed 2 weeks post-op, either at home or with your practice nurse, depending on how confident you are with wound care. What to look out for? So any swelling, redness, pus in your wound or any new high temperatures. If you have any problems with your wound, please contact the spinal team or if it's out of hours, the ward. On the day of your discharge, there'll be some certain goals that you need to meet before you can go home. We'd like you to be passing urine with no concerns. Eating and drinking, we'd like you to be mobilising safely and passed by the physiotherapy team. We'd like your pain to be manageable and your wound to be clean, dry and the dressing intact. If you did have any drains in following surgery, these will be removed and the site will be inspected. You will have some post-operative x-rays, so these will need to be completed, reviewed by a member of the senior medical team and satisfactory for you to be able to go home. The doctors will complete an EDAN or a discharge note, so this will need to be done and provided to you before you go anywhere. Any medicines need to be delivered from pharmacy. This can take a few hours sometimes, so having your own supply brought into hospital may speed up this process. Your discharge letter will be sent to your GP.
Following your surgery, do not be surprised if you still have some leg and back pain. The surgery is not to relieve back pain per se. It is more about hopefully addressing the leg pain, but that can take time. We would like you to be as active as you can as soon as you can. You just need to be careful. The nurses will take certain observations. If you've been told that it's fine, you can be getting up and about. So it's okay to get dressed and be getting up and moving. It helps your recovery. What you can also consider is starting gently doing your exercises that, all being well, you will be now more than familiar with. You don't necessarily have to wait for the physiotherapists to come and go through those. Although if you are unsure about them, do not worry, we will be more than willing to do that. As we've previously inferred, the aim of the surgery is more about trying to prevent deterioration of symptoms. So do not be worried if you can still feel some pain in your back or your legs. It does sometimes take time, particularly for the leg pain, to resolve. It is not of concern. What you need to do is, if you feel that things have gotten worse than they were before the operation, just mention that to one of the members of staff. It doesn't necessarily stop you from doing your exercises though. We still want you to be as mobile as you can. But if it is a genuine concern and you feel that you're struggling to do that because of the pain, don't hesitate to mention it to somebody. These are the exercises for the lower back. We start with pelvic tilts. Now this is where the hips rotate such that you alternately flatten the small of your back and then arch the small of your back. If we just gently put cross arms over the chest, you will probably be able to see the small of the back moving. So we're alternately flattening down and then arching up. And that movement comes from the pelvis rotating. Don't push into excessive pain. A little bit of discomfort, acceptable. The second exercise are your pelvic floor. Now this is where we want you to gently draw in your lower tummy muscles. And you are just gently pulling in as if you were stopping yourself from going to the toilet. And holding for a few seconds at a time and trying to do so without holding your breath. Again, shouldn't hurt. A little bit of discomfort though is acceptable. So this next exercise, which is perhaps a little bit more challenging, and consequently we don't always start with this, requires you to be laid on your side, and we actually call it the clam. What we want is you to be comfortably on your side, so pillars suitably positioned so that your neck's not bent sideways, one hip directly above the other, feet one on top of the other, and to start with, knees one on top of the other. The knees are bent to about a right angle and feet are in line with bottom. The movement comes from the hip, not the pelvis. So it's literally a rotation round sideways of your thigh, but keeping your pelvis nice and still. If you find that difficult, just try tensing up your lower tummy muscles a little bit, and you can feel that with your fingers. So just a little bit of tension there, and then lift, and you will know that you're doing it right because your pelvis will stay nice and still, and you will feel it in your bottom. It targets a specific muscle in your buttock. And this exercise can be done on both sides. So you would do some on one side, and then if you felt comfortable enough, you could equally do some on the other side. But go steady with this one, and it is important that there is no movement of the pelvis. If you can't stop the movement of the pelvis, it means you've done too many, you've done enough, stop, or you are trying to lift your knee too high. So again, don't. So this next exercise is in sitting. Need to be sat nice and tall, but with feet firmly flat on the floor. And we gently raise alternate feet by straightening alternate knees. Now you do need to be careful with this one. If this reproduces any pre-operative leg pain that you may have had, discuss with your physio. We will go through these exercises when you're in the hospital, and we will check that you're doing them as well as you can be and that you're not going to flare anything up. So after lower back surgery, you're likely to have some increased back pain, but it's nothing to worry about. That's because of the surgery. However, that is probably going to be made worse if you bend or twist. So we usually advise that you try and avoid that movement, and that is particularly important because you've had fixation that's involved metalwork being put inside. Now that means that it can be challenging to get in and out of bed. So the best way to do that safely, such that you avoid bending and twisting, is to adopt what we call the log roll. Now that means if you are laid on your back, the ideal thing would be for you to first draw your knees up, or at least one of your knees the furthest away from the edge of the bed. You are then going to push through your feet so that your body comes onto its side as you reach over for the edge of the bed with one arm. You then draw your knees up so that your lower legs come over the edge of the bed, and as they drop down, they're like a counterbalance that allows you to push up through your arms to bring yourself upright, avoiding any excessive twisting or bending of your back itself. You would also adopt a similar routine, but in reverse, to get onto the bed. If you were coming to the edge, you'd sit yourself down and then lower yourself onto one side as you bring your lower legs up, get your feet into the bed, avoiding the bend and twist, and if you want to go onto your back, do so in one, so that your back stays relatively straight. That way you should avoid any unnecessary discomfort or pain. As well as specific exercise, it's important to think about posture, and that includes in standing. It's best to avoid any slouching, and that might be shoulders dropping forward and or chin, or for that matter the opposite where pelvis thrusts forwards, puts undue strain onto your back. The best position is to be up nice and tall, tummy drawn in a little bit, shoulders directly over hips, neck nice and straight. Just imagine yourself trying to grow on the spot. Best position to adopt. That said, we want you to be moving, but if you do need to stand for any length of time, this is the position that you need to try and adopt. So not only is posture important in standing, it is equally as important when we are sat down. We want to avoid slouching or slumping, shoulders back, chin forward. We need to again be thinking tall but in sit. So effectively your pelvis rotates round, bringing your tummy forward but not to an extreme. Neck also nice and straight, shoulders relaxed. Nice comfortable posture. May find it slightly hard or difficult to maintain initially. You'll probably feel it in your tummy muscles after a while. So we'd recommend that you be thinking about it little and often. There is nothing wrong with allowing a chair back to support you in this position. But on occasions we want you to be actually adopting this position without support from behind, because it does work some important muscles in and around your tummy but also around your shoulders as well. You've got to be aware that recovery does take time. We want you to be gradually increasing what you do. The exercises that we have shown you, generally speaking, are what you need to focus on over the course of these coming months. Gradually build up the number of repetitions you do. We will talk about that when we see you, so don't worry about the details. You can also increase your general activity, your general exercise tolerance. You might start by walking about your living room, but then you can walk down to the bottom of the garden path, for example. Maybe gradually increase the distance, walking around the block. Might consider going to the shops. However, you do need to be careful to avoid lifting still. Your pot of tea is about what we want you to be considering. Anything heavier than that, such as a full kettle, would be too heavy. You do also need to be cautious about not maintaining sustained positions. It is okay to sit out, but we don't want you doing so for any longer than half an hour. Now, it's quite acceptable for you to be sat in a good supportive chair, but after half an hour or so, even if it's just standing up and sitting back down again, so long as you move.
So following your fusion surgery, you should avoid driving for 4 to 6 weeks. However, you may travel as a passenger before this time. Before you drive, you will need to have full function and minimal pain and discomfort before driving. You will also need to discontinue taking medicines that may affect your driving skills and safety. You should be able to perform an emergency stop. You do not need to let the DVLA know, but please update your insurance company before you begin driving. In terms of going back to work, office workers usually can return after 6 weeks. Manual workers sometimes need 12 weeks and to return on lighter duties if necessary. Please contact the Spinal team if you're unsure. In terms of follow-up, you'll be telephoned by one of the spinal nurse specialists after 2 weeks to check in and see how you're doing. Around this time should be when your dressings will be coming off, so we'll check that this has been done. You will also have a 6 to 8 week follow-up, either in clinic or over the telephone, with a spinal nurse specialist or your consultant. If you do have any questions before this time or beyond, please do contact the Spinal CNS team. The numbers are provided in your spinal booklet. Thank you.